The World Health Organization clearing up some confusion about asymptomatic people and their ability to spread the coronavirus. Yesterday, one of the doctors on its coronavirus response team said asymptomatic spread was, quote, very rare. But today, during an online Q&A, that same doctor said the amount of people who truly remain asymptomatic is not known. She also said that she used the phrase very rare based on findings from a small number of studies that followed asymptomatic cases, adding that she did not mean global cases of asymptomatic transmission were rare.
What I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit. But some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here.
In a statement, the CDC said some people without symptoms may be able to spread the virus and that they are looking at new data to better understand transmission routes. Stay-at-home orders were put into place during this pandemic to slow the spread of COVID-19, and a new study suggests those measures worked. Mandy Gaither has the details.
Empty streets, closed business signs, sights Americans won't soon forget. And a new study suggests if we hadn't done all that we did, staying home, closing schools, restricting travel, staying socially distanced from the beginning of the pandemic through early April, there would be about 60 million more coronavirus infections nationwide. The research published in the scientific journal Nature used a modeling technique typically used for estimating economic growth. It measured the effect of shutdown policies in 6 countries. The study period ended on April 6th, but keeping shutdown orders in place after that time has likely led to even more coronavirus infections being avoided, according to the study's lead author. The study included data on daily infection rates, changes in coronavirus case definitions, and timing of large-scale shutdown policies, but it had some limitations, including that available data on infections and measures across the country studied were limited, and researchers could only suggest estimations about what could have happened. For today's Health Minute, I'm Mandy Gaither.